demonstrating the instrument trolley. You can see all three she has maintained, the nursing officer, with 2 scissors, one curved and one straight, one back box, one non-tooth and another tooth forceps. And this is the 22 number blade. So count of instruments prior to surgery is one important aspect of safety of the mother. Thank you. So cleaning the surgical site has to be cleaned first in a circular fashion. So betadine, povidone, iodine needs contact time of 2 minutes. So don't be in a hurry in doing painting of the abdominal wall. So I use one separately for the incision side. Now I'm going with the second swab, always in a circular fashion. Thank you. Indwelling Foley's catheter in place in the surgical field after painting with povidone, iodine and spirit. Properly drape with surgical drapes. Only the surgical window has to be exposed. Only the surgical window has to be exposed. And then you can also see a partition where that is for the anesthetist field, and this is a surgical field. Thank you. This is the head end of the mother. NIBP monitor connected to the NIBP monitor. One hand is connected to NIBP monitor, the other hand is connected to the pulse oxy with the IV fluid running. Mother is given oxygen throughout. Mother is connected to the multi-channel monitor where we can see the pulse rate, saturation, blood pressure, alarm system in place, and the oxygen on flow around 4 liters. This is a case of one previous section. We can see the previous scar is being held with the Alice forceps, and as a first step we are excising the previous scar. Thank you. So skin and subcutaneous tissue has been incised. Now we are holding the rectus sheath with the Alice forceps. Hold it properly. Now giving a sharp cut in the midline. Okay? Yeah. Thank you. Close. The incision is extended bluntly with the fingers. So the rectus sheath has been dissected on the right side of the mother. Thank you. Blunt dissection on the left half of the rectus sheath is being done with the fingers. Thank you. Dissection in the midline is being done to separate the rectus muscle from the underlying rectus sheath fascia. This has to be done both at this level and at the lower level. So having an adequate incision is very important so that we should not struggle when we are delivering the baby. Thank you. The glistening fascia, it is always ideal to hold it with the straight artery forceps, giving a sharp nick. And I have selected an area which is higher, because lower there is a risk of bladder. Now the peritoneum is open. Thank you. Hooking the fingers below the peritoneum. Never hook under the rectus muscle. You will be injuring the inferior epigastric. Okay, Dr. Madhavi? So hook your fingers below the rectus sheath and gently pull it laterally. So this is the blunt way of opening the peritoneum. Thank you. Action is being done, but don't incise too much of the rectus sheath. Rectus sheath is very vital to prevent incisional hurt. This is the previous scar. You can see it is very much thinned out. This is the junction of the upper segment and the lower segment. How do we identify the lower uterine segment is the loose fold of peritoneum. This is the loose fold of peritoneum. So this portion represents the lower uterine segment, this portion the upper uterine segment, and the previous scar is intact. You can see the full length scar is intact. Only thing, it is very much thinned out. Thank you. It has been opened. The bladder flap has been developed and it is pushed down. Now this is the lower uterine segment where we give the uterine incision. Thank you. Please come. So this is the Doyne's retractor in place. The assistant is trying to show me the lower uterine segment, and we see some few vessels over here, and there is partial dehiscence I feel of the previous scar. Thank you. Make out the previous scar. It is given at a higher level at the junction of the lower segment and the upper segment actually. You can see the white one. Yes, so I am avoiding that and I am taking a curvilinear incision in the most widest part of the lower uterine segment. Right? I am using the other end of the blade to see if I have given adequate incision. Now the danger is you should not injure the scalp. Thank you. This identifying the lower uterine segment is very important. We can see the bladder here, isn't it? Can you all see the bladder? So the bladder is here and the Doyne's retractor is over here, and this is the loose fold of peritoneum. So I'm just lifting the loose fold of peritoneum, then insinuating the scissors, separating it, and then cutting the UV fold of utrovesical fold of peritoneum. On either sides we'll have to do it, and then holding the lower edge, gentle, with the finger is being done, and then I am repositioning the Doyne's retractor. Now the bladder should never be in the field. See, still it is somewhere here. Yes, so don't get compromised. So you will have to dissect this fascia, isn't it? Till you see the lower uterine segment very correctly. So this is the, now the bladder has gone completely down. So this is the lower uterine segment. Thank you. We can see the previous scar is, there is a partial dehiscence on the right side. So I am trying to give an incision, curvilinear incision. It's a very thinned out lower uterine segment because the IP interval is very less. So gently separating. Always try to preserve the membranes. Okay, Madhavi? Yes. And then this is the cephalocaudal, extension of the uterine incision. That is towards the head end of the mother. Okay, Madhavi? Okay. Now I place my hand between the head and the lower uterine incision. Then you take on the retractor. Most important step is flex the head, and then can I have little gentle fundal pressure? Yes. It has to be very controlled and gentle. Please take it. Yes. 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 Some more. Thank you. Thank you. So baby head has been delivered. The most important step is drying the baby, not pulling out the baby. Okay, don't be in a hurry. Gently you can deliver the baby. Oxytocin has been given. Baby is crying and there is no need for this mucus sucker when the baby is crying. See, only the shoulders till that point I have delivered. And gently now the breech part. Okay? Yes. Now can you feel for the cord pulsations? Can I have one dry baby towel? Thank you. Fine baby, you're doing well. And see, look at the cord. It got entangled on the 2 feet. That's fine, but the baby is active. Of the cord, I am placing the clamp. Can you give me one straight artery forceps so that I can just Clip it. Yes. With the straight mark. Press it with this. Good job. Now give me the cord clamp. Give me one gauze piece.